start recording. Love that lady. She's my favorite. All right. Welcome everybody to our Wellness Wednesday for May. I'm so excited to see such a lovely crowd. We got about, looks like 15 people in today. So exciting. My name is Cindy McKinney. I'm Associate Director here at Parkinson's Association of the Carolinas. And with us today, we have the one, the only Miss Darci here. She is an occupational therapist, and she also has the awesomeness of owning a gym. So I'm very excited to see how all of her knowledge about Parkinson's and movement is going to come to play today. So I will let you take it away, Ms. Darci.
Thank you for the introduction. Good afternoon, everyone. My name is Darci. I'm an occupational therapist. Let me switch over to my PowerPoint. All right. Let me know, Sydney, if for some reason people put in the chat that they can't see that.
I definitely will.
Okay. So today we're going to talk about why movement matters with Parkinson's disease, how we can help people make progress to optimize their dopamine and feel better and help all other types of Parkinson's symptoms and things that are affected. Oh, and like Sydney mentioned, I'm an OT, but I run a neuro wellness facility. So we are not a typical outpatient facility. We don't actually do therapy here, but we do training for people of all different neurological conditions that are overseen by a therapist. So we can help everyone in their health and wellness and recovery journey. So movement matters in Parkinson's. And we're going to talk about what the research says and why it matters. We're going to talk about how exercise has shown us through research to be medicine, because there's so much awesome research out there. So we're going to look at how to follow the guidelines to optimize that potential. So exercise is medicine. We can help persons with Parkinson's feel better. And we actually have the potential to help reduce some medications and help manage symptoms and make progress. Safety is very important. So we want to make sure that everyone is set up for the best optimal outcomes. So don't expect to jump out of the gates and be ready to exercise with some of these guidelines. I think the best way to look at it is I'm going to start at one place. I'm going to every day or every time I exercise, just chip away a little bit more. So we're going to talk about safety considerations and if you need a jump start to get started, kind of who to do that with or how to do that and some other tips. And then definitely for modifications in progress, whether it's for safety or for any other medical needs, there's definitely lots of different professionals out there to kind of help you along your journey to get you to where you want your exercise habits and health and wellness training to be. And then a community support system is huge. To know that you have like-minded people, partners, groups that are in the similar place as you, whether you're a person with Parkinson's or a spouse or a caregiver or a loved one, utilizing a support system can really help in so many different ways. So we're going to talk about neuroplasticity and what part that takes place in exercising. So neuroplasticity is the ability for our brains to be plastic, that they can change, they can improve, and they can adapt. So this is how that we can challenge our bodies and mind, and we can, because of that stimulus, improve, make changes. Our bodies are wonderful in the ability to be affected by something and make change. So that's a lot of the foundation with we can exercise, challenge our bodies and brains to have a better optimal outcome. And research is definitely standing behind that this is something real and definitely can be done. So let's talk about how neuroplasticity can work and how it's been shown that it's effective. So this comes down to what does dopamine mean for the person with Parkinson's? Dopamine is the chemical messenger in our brain that helps us function and send messages to make connections for our thoughts and our movements. So In a typical brain, that dopamine is going to help send messages from different parts in our brain to make us move, to help us think, and to help connect the dots as we have thoughts or intentions to move and to carry out signals in our brain. But when you don't have as much dopamine, then that message has a harder time being delivered. And so what the challenging part is how do you optimize what dopamine is there? It's going to be, you're not able to create more, but you can make it more optimal to use it, and you can help it make it more efficient. So exercise is proven that it can make our dopamine utilization more efficient. And so that's our goal when we exercise and we move, is to learn how do we get that dopamine to work for us in the best way possible so we can function better, so we can decrease any symptoms that are holding us back and making life more challenging. So research has shown that different types of exercise affects our dopamine and our neuroplasticity, and how we can manage our symptoms differently, such as aerobic exercise and having enough intensity of exercise, meaning getting your heart rate up, going fast enough, quick enough, helps with circulation, helps with our heart health, and is amazing for our Parkinson's symptoms and for that neuroplasticity and that dopamine release. So cycling, treadmill work is really, really important. But in order to also work on bigger movements and better functional skills, we need to challenge our bodies in different positions, movements, to build on that dopamine, to help our brain know we need to move big, to have more normalized movement patterns and not be as tight or have any rigidity limitations. So also a multi-directional movement is important. So for instance, there's an image of someone swinging a racket, working on dance. So different intentional movement patterns to challenge our bodies for different movements. So just cardio alone is not enough. You have to have a variety of exercise to make your holistic workout routine. And then it's very important to challenge our brains. We want to think about our brain almost as if it's a muscle, and we need to exercise our brain to have the best optimal outcomes. And so working on deep breathing or balance work is going to help with our brain exercises to help us put all the pieces together. So we are heart healthy, brain healthy, movement healthy, all working towards the best neuroplasticity results to have an optimal outcome. So research says that we have to move big and we have to push intensity. So we also need a variety of exercises. So intensity matters, and we'll go into specific, how do you know if you're pushing yourself hard enough? What guidelines can you follow? And what does research show us? So we know that we need to push ourselves hard enough. We also need to practice. So if you want to be able to get on and off the floor with your grandchildren, you need to practice getting on and off the floor. Because if you don't practice in that movement pattern, activating those muscles, then our body's not going to have the practice to be as thorough and efficient to be able to do that. And we also need to include our whole body in the exercise. So we need to use our hands, we need to use our eyes, we need to use arms, legs, trunk, everything for a good cohesive approach. And exercise is the building blocks of function. Like I said, we need to practice to improve moving better with balance, walking, getting up and down from a chair or to the floor. So to improve function, we need to exercise. And research has also shown us that if we address exercise, that you can optimize that dopamine and you can slow the Parkinson's progression almost in its tracks, but you need to maintain that exercise. So this isn't going to be I'm going to work out and get a good routine. You need to start great habits to build exercise in. And your exercise habits can change over time with your interests, which is the great thing. You might fall in love with brisk walking, but you might start doing pickleball as you get steadier on your feet or stronger. And so you can change your exercise habits over time, but you need to maintain and be consistent with your exercise approach to have the most optimal outcome. So what specifically will exercise help with? It will maximize the dopamine that you have to make it more efficient so your brains can function better and decrease Parkinson's symptoms and any other effects that it's having on your body. So it'll help you live longer, it'll help you sleep better, it'll help you utilize your medications better, and increase your quality of life because you're sleeping better, you're living longer, you're feeling better. And exercise will help decrease your fatigue, which sounds a little silly. If you're working out, you might be tired, but if you get used to working out, you're going to have those hormones and that increased circulation. So you're actually going to have more energy and you're going to feel better. Exercise is also going to help you reduce any constipation risk because you're going to be more active. So you're going to have better bathroom habits. And also with that increased circulation and movement really has a great effect on our brains, not only cognitively, but our mental health. It's going to help you feel better about yourself. It'll help you have less anxiety because you'll be more confident in your skills and you'll be feeling better. This can also decrease any assistance that you're needing from other people because you're going to be stronger, you're going to have better balance, and you're going to feel better. So let's talk specifically about how we can make exercise our medicine and what the special dosage is. So I have a chart on here that talks about what's the best holistic approach for exercise. So there's 4 different areas that we want to look at. And the bare minimum ideally is we want to strive for exercise in at least 3 days a week. And within those 3 days, and it doesn't have to be 3 days, it can be 7. Find the right solution for you and build up towards that to make yourself most successful. So ideally, research has shown us that 150 minutes of moderate to vigorous exercise per week is the ideal number and intensity level that you want to aim for. So as far as aerobic exercise, so that's going to be something as a brisk walk, so really getting your speed up, or running or cycling or swimming or aerobic class to get that heart rate up. You want to do that for at least 30 minutes. And you want to do that a few times a week. So you want to get that heart rate going to help that blood flow, that heart rate challenge to be heart healthy. And then you also want to find time in your workout routine for strength training. You need to build and maintain that muscle mass so that you have the strength to do the things that you want to do and to help you with safety. So ideally 2 to 3 days a week for strength training for 30 minutes, working on all the major muscle groups and utilizing weight or resistance or even your body weight. So this can be hand weights, this can be resistance bands, this can be getting on the ground and using your own balance in different positions, or also you can use your body weight with lunges and standing work. So there's a very big variety of ways that you can address strength training. My mom's best strength training is her gardening. She loves gardening. She hates working out. So how can you incorporate that with your wheelbarrow carries or something like that? It doesn't always have to be time spent in the gym, but to factor some time in for that resistance training to load those muscles to cause change. You also want to work on balance, flexibility, and multitasking. Again, that 2 to 3 days a week, so that your balance is getting challenged, so that you are safer on your feet. You also want to work at large movements in multi-directional areas. So if we just practice going forward and backwards, we're only going to be really stable forward and backwards. We need to practice side stepping, diagonal stepping, so that we can walk over the toys on the floor or navigate the spill that maybe we made in the kitchen. So we need to practice in all directions to have the best balance and stability. And so that you can do that in activities such as yoga or Tai Chi, dancing or boxing. And then we also want to make sure that our muscles are staying nice and elongated. If we're stiff and tight, then it's going to be hard to use our body. So we want to have a good stretching routine, at least 2 to 3 days a week. You can do this as a warm-up to a workout. You can do this as a cool down, but it's very important to maintain your range of motion throughout your body so that you can stay loose and utilize your body as you want to. And again, I'm going to mention that the best exercise plan is the consistent plan. So finding time to put on your schedule or build it into a habit to form that great routine to build on, because this is going to be a a great commitment to put towards your health and wellness. And one exercise is best. So you can kind of concoct what's going to work best for you. What are you motivated to do? What are you enjoying to do? But what you want to make sure including is getting that heart rate up to get moderate to vigorous intensity, and then applying a balance factor, a strength resistance factor, and some stretching. So specifically more aerobic exercise, we talked about intensity matters. Now, how do we know that we're intense enough? How do you judge that? So this can be done in a few different ways. You can have a heart rate monitor. Maybe you've got a smartwatch that you can use. If you don't want to use technology, there's also, we're going to look at a rate of perceived exertion scale. So this can be a subjective measurement of how hard am I working, and we'll give you some guidelines to know if you're working hard enough so that you can reflect on how hard am I working? Am I out of breath, or am I kind of leisurely working out? Do I need to push myself harder? So we want to make sure when we're trying to get our heart rate up that we're looking, self-reflecting, how hard am I working, and really push yourself to get to that moderate, vigorous exercise zone. That's one of the most important things that's really been hugely reflected in the research. And so sometimes that can also be done by increasing the speed of your movement when you're safe to do so. And so that the best general rule of thumb is working out to what feels hard and challenging. The saying of that you need to get comfortable with the uncomfortable, to push yourself a little bit harder to create change is going to be true with your workout habits. You want to do a workout that you're going to perceive it's somewhat hard. You don't want to be stuck in an easy workout. You want to always kind of be pushing yourself to work a little bit harder. So this scale is the rate of perceived exertion scale, and it's a scale from 1 to 10. And so when we talk about our moderate to vigorous exercise rate, when we look at this scale, we want to look at the green, yellow, and yellow areas. So we want to have moderate to vigorous activity. That means we want to be breathing heavy while we work out. We want to be able to hold a short conversation. If we're really chatting back and forth and not winded, then we're not quite working hard enough. So we need to be a little bit more breathy, working hard to know that our heart is pounding and working hard for us to get a great workout. And it's okay to get a little uncomfortable. Now, we don't want to go into the unsafe zone, but we want to be pushing ourselves to be working out, to be having a little bit higher heart rate. And ideally, if you are using a smartwatch or you have someone to help guide you through looking at your heart rate and your heart rate max, you want to get to 60 to 80% heart rate max to really target that dopamine effect. You want that dopamine to be working more efficiently. And so dopamine zone is going to start at this scale on a 7. So you want to be really pushing yourself short of breath to show that you're working hard enough to get that dopamine going, to really get that game-changing exercise input for your workout routine. So what safety considerations do we need to do? This is important. Again, I'm going to reiterate, don't feel like you need to jump out of the gates and go run on a treadmill until you can't breathe anymore. You want to stay safe, build yourself up, where if you can sit on a recumbent bike for 5 minutes and you get winded, that is an awesome, awesome start. Even if it's just a few minutes, the first most important thing is just to start. So let's talk about how to be safe with that start of workout habits, or to pick up where you're at and to go to the next level. If you have any freezing of gait, you want to be very mindful of that. You don't want to risk any falls. It's going to set you back. So if you need to look at any therapy referrals to make sure that you are safe, that's something you can look at to have a really good understanding of how to work through that or get stronger and improve on those skills. You also want to know what your blood pressure is like. If you've got really low blood pressure and it's going to make you dizzy, working out where you're up and down off the floor really quickly isn't a great place to start for you. You might look at, do you need to look at when your medications are helping you, what the time of day is, what your blood pressure is like around your meal times. Kind of know how your blood pressure affects you so that you can keep yourself safe while working out. If you have blunted heart rate, know how that factors into your workout routine. And also look at your stiffness. Do you need a really good warm up so you're not stiff and tight so you can build up into your workout? Or maybe you need to really work on your stretching routine before you can push yourself harder into that aerobic exercise. So something to be mindful of. And so stiffness and range of motion go very kind of hand in hand. If you can find a great workout routine that incorporates stretching, then that's kind of a win-win. You can warm those muscles up, stretch and lengthen while you're working through a comfortable workout routine with the goal of improving in your range of motion as you strengthen and lengthen those muscles is a great approach. And then make sure that you're being safe. If you're doing something really quick and you can't quite keep up with the speed of something, know that it's okay to go at your own pace, and exercise routines that include a cognitive challenge. Working out our brain is like a muscle. We need to challenge it. We need to exercise it. And with that exercise, we're going to see improvement. So it's okay if something's too quick or really hard at first. Give yourself some room to grow and make progress through that. Make sure there's some good support system built into any balancing challenges. Use extra support devices, have a workout buddy. It's important to stay safe and make sure we're not going to be too off balance while we're working out. And if you have any osteoporosis concerns, maybe talk to your doctor if you have anything they need to clear you with. But strength and resistance training and getting up on your feet and moving should really help with those, but make sure you're within the safe zone and speaking with your healthcare provider to keep yourself safe with any limitations that they might guide you through. And then you really want to be respectful of pain. The saying, no pain, no gain is not a real thing. You want to be respectful of pain. You want to listen to your body. Pain's going to be indicating that something's maybe not where it should be. Maybe you need to pay attention and stretch more because the pain's because you're tight or you're overusing a strong muscle that's compensating for a weak muscle, and that's part of your pain. So a therapist can help guide you through that, or working with a healthcare professional or exercise specialist can help you if you have some pain problems and help modify a workout for you and to make it safer for you. So it's always important to seek expert advice to stay safe. Look for a movement specialist to identify any of your risk factors and to help you adjust exercise. So this is going to help you optimize the exercise that is right for you and to make progress. And also, I think it's very beneficial if you have someone that can give you a functional assessment to get a good baseline. I think the hardest part is when you don't notice the day-to-day changes. If you have someone that can give you some objective measures, or it might just be a video of how you move or some pictures of your posture, and then to reflect back on that a few weeks, a few months later to say, hey, look at my posture. It's really improved. Every day we don't notice the change in ourselves, but if we have someone who can give us a baseline or something to look at objectively, we can notice that change. So I think utilizing a workout specialist, a healthcare specialist, a therapist to help you know that you are making great progress is always rewarding and gratifying too, to know that where you've come from and how far you've made great progress. And also just be expecting gradual change. We're not looking for rocket science overnight or things to happen really quickly. Give yourself grace to chip away at your exercise. Every day, try to go 1 more minute longer for your aerobic workout. Give yourself time to maybe just add a few more reps at the same weight until you're ready to go to the next level. Again, so safety is going to be the best way to have a great, steady trajectory towards your health and wellness goals. So let's talk about group exercise. Why would group exercise be better than one-on-one? So research has proven that you can have better results working in a group than at home by yourself or even with one-on-one. So there's a lot to say to working out with someone. Someone can be a role model in the class that you admire their posture. And so that can be your internal motivator to say, I'm going to keep working out because I know that that person that I always have in the corner of my eye has worked so hard. And I've seen how great their posture has been. I know I do that in workout classes. I need a motivator when I'm not feeling great and maybe didn't want to go to that workout class, but I see someone just killing it, and it motivates me to work harder. And I think there's a lot to say also to working out with people who have similar needs as you. So knowing that other people are going to have tremors or tightness, or that their posture is not as good. So there really is strength in numbers, knowing that you all are addressing similar goals. You're on somewhat similar path, and to find a lot of support with that, and also accountability. You can be a friendly workout buddy and say, hey, I missed you last week. And that might help encourage them the next time that they weren't feeling like coming to class to actually come out to the next time. And so I think it's important to know that a group can really celebrate your efforts, notice when you've made improvements, when maybe you haven't noticed it yourself. And there's also wonderful benefits for caregivers and spouses to help meet each other, see each other. If everyone's carpooling and dropping off, whether in the waiting room, to kind of talk about their shared experiences, being a supporter of someone with Parkinson's. So I want to talk a little bit about a wonderful Parkinson's exercise group training method called Power Moves. It's developed by the same founding therapist, Becky Farley, who's in Tucson, Arizona. She's a physical therapist and a PhD, and she was the founding therapist for LSVT Big. And so LSVT Big is done in a therapy clinic. It is a strict 4-week protocol. And so that is an amazing program that has great outcomes for persons with Parkinson's in therapy. But after you're done with therapy, like we were mentioning, you need to keep exercising to maintain your trajectory and maintain your abilities so that you can keep doing what you want to do. So that's where Power Moves came from. It is the next step after therapy, or if you don't need therapy, to maintain people on a good health and wellness and ability level that targets specific needs of someone with Parkinson's. So it is research founded, and it's a continuation of therapy, and it's going to help you restore function if you're not functioning as well. And if you are functioning well, help you maintain that. So an example of how do you restore function or maintain function, if you don't practice getting up and down on the floor, then you might lose the ability to do that, or be more fearful of falling because you're not used to getting up and down off the floor. And a lot of the strengthening ways that we develop as humans, we're on the floor, and that helps us strengthen and develop good strength and stability to build on to be safer walking. So a lot of our strength training in the therapy world comes down to how did we develop and get on the floor and exercise and use our body weight. And so to be able to maintain good sit to stand, good getting up and down off the floor, Power Moves is designed to work out in all 5 positions, meaning on your back, on your stomach, in a crawling position on all 4s. Which one did I forget? Tall kneeling and standing and in sitting. So we do exercises in all of those positions to help maintain what we can do and to improve. And the targeted movements in all those different positions is to work on posture, to help make sure that we have great posture and extensor strength to stay tall. We also work on rotation so that we can twist, and we move every day in functional movement patterns. We want to strengthen in those movement patterns to help us function. Weight shifting is very important. That helps us feel comfortable to break through that freezing gait, to shift weight, to help us step and move and be safe walkers. It's hugely important in how we function outside of just the walking world too. So we weight shift through a lot of the movement patterns. And then we also strengthen in stepping transitions in all directions. So addressing that multi-directional movement patterns that's indicated that we need to utilize through research, we are going to strengthen in our stepping and multi-directional movement patterns in all 5 directions. So where can you find a Power Moves class? There are therapists that can be certified. You can look on their website to find the Power Moves therapist, as you can also look on LSVT Big, where to find certified therapists. So our gym recently opened up a Power Moves exercise class. So if that's something that you guys would like to try out, we are inviting the community to either call us or email an RSVP that you'd like to join us. We have a Wednesday at 10 a.m. workout, and first class is free. And if we get a good following, we're hoping that maybe we can get some grant funding to offer the workout for free. So please come try us out, give me feedback to how to make it better. And we really want to help the community with Parkinson's thrive and be safe and help them with their exercise needs. So we talked about all the ideal exercise ways that we want to work out. We also want to make sure we're taking time to recover. Stress management can really go a long ways to help us manage our mental health, can help our muscles recover. So it's important to take that time to stretch. We talked about range of motion, but stretching can be great for stress relief. It can help our muscles lengthen and recover. So make sure you're not exercising too much to work out, to get too tight, or to cause any other effects. So take time to stretch or to get a massage or take time to meditation. There's great apps that you can get on your phone. I know Netflix even has the meditation shows that you can watch. They can coach you through how to work on your breathing, how to self-reflect, how to kind of tune out all those other things that come into our head. So make sure in your workout routine that you also factor in a recovery method for mind, body, and spirit. So make sure that you make movement matter to you. Find an exercise routine that is motivational, that is fun, that is the right match, whether it's a workout partner, a workout group. Find your tribe that's going to help you be consistent, hold you accountable, and to help you meet your goals. So if you need any help with this, there's some great opportunities throughout Charlotte. We would be glad to have you consider us. We are not, like I said, a therapy gym. We do have rehab in our name, but I'm an occupational therapist and I oversee our exercise physiologists, and we utilize that aerobic training to help target people's heart rate max, to make sure that they're getting that good dopamine going, to utilize it in that neuroplasticity to make change and have the best optimal workout plan for them. So I've been an OT for over 17 years. I'm Power Move certified, and I'd love to help you with any of those goals. Or if you go somewhere else, make sure that they can guide you with that right cardiac routine and safety. So there are some places you can look at to make sure maybe you have a safety harness. So it's going to give you better peace of mind and maybe not anxiety that you might fall, help give you confidence to push harder to get that heart rate up for safety. So we have a harness over several different pieces of equipment. That could be something very advantageous to get you to the next level and to make you work harder. And then just some other equipment that we utilize at our gym. And resources, and that's it. And we can look at that chat and see if there's any other questions that I can answer for you guys.
Yeah, if you guys have any questions, we would love to hear from you guys. I've been checking the box regularly, try to see if there's anything there. Darci, I learned so much from you. I was
good.
I was like,
trying to be helpful.
Even for me, I'm over here like, oh, so that's how I should be working out. Interesting. So thank you. I'll give everybody, I know it takes a second to type. I'm a slow typer, so I'll give everyone a second if they want to ask any questions. No pressure.
I have a question.
Go for it.
Hi, Darci. Thank you so much. It's very, I really enjoy the presentation. It matches what my husband is passing right now. And one thing that I noticed on him, even though he takes his therapy, I think the mental health issue is one of the biggest pieces in Parkinson. So how to motivate him to do the exercises. Another one is we live in Durham, and I don't think we have enough resources as you do in Charlotte. So probably I need to move him to Charlotte in order to join, all those wonderful sessions that you have during the week and the weekends. So is that any place that you recommended here in Durham? Can he join the gym? But I'm not sure how to approach on that.
So the first thing you mentioned was motivation. I think talking to him and maybe seeing what's his fear of maybe just trying something, coaching him through, let's just try a class. You might hate it and we'll do something fun afterwards, or, you know, something, maybe say, hey, if we go do this, I know you love to go out for ice cream. Let's go out for ice cream, or find something motivational to reward him. But also I think a lot of reward in it could be that he feels better, he moves better. If he finds, I worked out with a lovely lady today, and she said she finally went to Rock Steady Boxing and found people she could connect with and knows she wasn't the only person. So I think it's huge, just that start, you know, and taking time to talk with your spouse about maybe what's the fearful part. Is it the walking and getting all the way into where the gym may be? You can always drive by the facility, maybe write down what his concerns might be and make a phone call or an email to somewhere that might be able to help with that exercise routine. And there's so many online support groups. I know you said you're not local, but maybe see if there's a local Parkinson's group. And so it is a very exciting time to be a therapist with the Parkinson's research right now. And there's a lot of gyms and therapists that are trying to find a way to connect our community members with this guidance, knowledge, and their health and wellness needing. So I would do some Google searches in your area and look up Parkinson's exercise classes, because there are gyms like ours that are popping up. And I know in the chat they mentioned LSVT, how to look up a clinician. I would look up a Power Moves class, because that's going to be the community-based Parkinson's training, and it's PWR. If you look up Power, there is on their website a directory that you can look up therapists or trainers that are certified. And I would just email them and say, hey, do you offer classes? Are you familiar with any in our area? And they should be a great resource, hopefully, for you.
Thank you.
And if you're on social media, I have found a lot of gyms through social media. If I look up Parkinson's Wellness or Power Moves, that's where you see a lot of places that want to help connect with community members and say, hey, we're working out, can be part of our tribe. Let's support each other. That's been a good way, if you're on social media, to look at, like, search under the hashtags Parkinson's Wellness or Power Moves. I'll find a lot of places that way as well.
Okay, thank you.
And I put in the chat for you one of the Power Moves certified trainers that I found that you can look at. And there's a bunch for Power Moves. I looked it up, tried to find one link that was a little bit together. There's a lot out there. And with Parkinson's Association, we also have boxing classes and yoga classes that should be in and around your area too, that he can go to. And I have been to a few, and they are so much fun. I can't even begin to express. So if you ever wanted to go for that, I can get you that information as well. We also have in the chat from Blake asked a question: what is the main takeaway when someone asks what dopamine is?
I think the main takeaway is that dopamine is what's in short supply that causes Parkinson's symptoms. And so also knowing how to utilize what you have, which is going to affect your Parkinson's symptoms. So if you can exercise, and exercise helps you utilize your dopamine, that's kind of why dopamine is such a hot topic, because that's the imperative on the cellular level that makes people feel better and move better. So the main takeaway is find ways to help utilize it, which is exercise, healthy diet and habits, and talking to your physician if any medications are helpful in that as well.
And Darci, I love how earlier you said your mom was gardening, and that's one way you could, I was like, oh, that's what my mom does. Do we have any other questions from anybody? I don't have any more in the chat, but I don't know if anyone would like to unmute and ask.
So I don't know, Sydney, if you guys will email out to the group or have that opportunity, or people are welcome to email me. I have created a handout that has those exercise recommendations. of how often to do it. So I've created a workout weekly chart, so you can write in how often you worked out, and it also has the intensity with that intensity chart. So that you can have, you know, a weekly, you can print it out or let me know the best way to get it to everybody is. So I can help be your accountability. Oh, this week I took off, or things were busy, so I didn't meet my 150 minutes. Let's see if I can pencil it in and find good habits, whether it's on your schedule, reminders, working out with a partner or a group to help you meet your goals is going to really help make you successful. So I'm hoping that maybe that exercise chart can maybe get people moving in the right direction.
Awesome. Yeah. If you could send that out, I will send that out in a mass email, put it all over the place because that's amazing. I'll print it out for me. I also see Dawn has a hand raised. So if you would like to unmute and ask your question.
Yes. Are there exercises that can improve swallowing? I'm just noticing the beginning of a harder time swallowing. Mm-hmm. And I'd heard that there were things like reading or aloud or speech therapy. Mm-hmm. I'm trying to understand, and I know that one of the dangers will be aspirating food into the lungs. So I wondered if there's some exercise routine or someplace I can find information. You could send it to me to my email if you don't want. Let's do it now.
Don, that is a great question. So a speech therapist is going to be your best resource for that. I am not a swallow expert, but Parkinson's affects our muscles everywhere. Like I said, our brain is like a muscle. We need to exercise it. Our eyes, your vision can be changing. So we need to practice moving our eyes with exercises. So a lot of exercise training with Parkinson's and the different programs, or even in therapy, we talk about following the movement with your eyes so that your eyes are having exercises. So if you look up LSVT, you can look for a speech therapist. And if you notice that you're having some speech or some swallowing changes, I would ask your doctor for a referral and get a customized swallow home exercise program. And that way, you know that you're doing the right ones, or they'll catch anything that maybe you need help coordinating your swallow or something like that. Speech therapists are awesome. So I would look at a LSVT trained speech therapist.
Thank you.
Mm-hmm.
That's a great question. Does anybody else have a question?
I see Christian left a message talking about slowing down the progression of the disease. So Parkinson's starts way before we're able to see the symptoms. So the Parkinson's, the decreasing of dopamine release and the cell bodies that produce the dopamine can start well before we notice any symptoms and that it's medically caught. But once you know to do it, or to do the exercising or address it medically, instead of letting the Parkinson's run its course, you can slow the progression by utilizing the dopamine that you have left. So you can do that with medications, you can do that with exercise. So by maintaining the most optimal use of your dopamine, that's how you slow the progression. So I've followed some other gyms and they have records of people who've had Parkinson's for over 10 years, and the person's still better off 8 years out because they've been exercising. So they've slowed their progression and increased their function because of their exercise routine. So I think it's awesome to find some of these examples, and hopefully you guys will be the next. Now that you are empowered to get your heart rate up and to strengthen and cause great exercise routines, that you can make yourself better. You can slow the progression, but you have to, consistency is key. You need to keep that exercise routine and create great habits to help slow it and make change.
Mm-hmm.
In LSVT, I'll put it in the chat. So LSVT is the therapy approach that's research-based, that's a strict protocol that therapists can do. PTs, so physical therapists, occupational therapists, and speech therapists can be trained and certified in this LSVT approach. And it's on the big basis of it, which I said is similar to Parkinson or Power Moves. Power Moves is the community wellness approach that isn't rigid in a protocol. LSVT is a strict protocol that is research-based in therapy. And the whole approach is to work really big and really loud. So the speech approach is to help vocalization, because a lot of times in Parkinson's, voices will get softer. So it's to help those muscles for projection to get loud. And for PTs and OTs, it's working with arms and legs and mobility to work big so that people don't get tight and rigid. So if you're having safety risks or change in function, you can find a therapist near you by searching for LSVT to find the best movement specialist to help you make progress or point you in the right direction.
One more question. Maybe I'm asking so many, but I mean, it's so good to see other friends here in the Zoom. I was wondering, and I know this is another extra maybe coordination for the association, but I notice a lot that social involvement, and we need to realize we have it in pandemic, so many things that have been closed. But is that any way that the association can create, kind of like you say, Darci, a peer support, which means I am not sure how many of you that are here in the Zoom have the disease, or they are spouses or, or family members or friends with the disease. Is that any way that we can have like, kind of like, you know, one-on-one or maybe two of them talking and supporting each other? I feel that socialization for many of them is very hard, and makes them kind of like, no, I don't want to speak with somebody because they can judge me, you know, even though we're in this modern years, but that's what they feel it, you know. And I think each of them, they are very different, but I was wondering if that would be possible.
So we actually do with, oh, I'm so sorry.
Go ahead.
I was going to say what resources we had with Parkinson's Association. So we can personally, we offer support groups that are in different areas. We also do a virtual support group once a month. It's the first Wednesday of every month at 2 p.m. and Zoom like this as well. And we try to get to where people want to talk, but sometimes it is hard because, you know, we have a group of 20 plus here today, which is amazing and great, but some people would not feel comfortable with that. So we do offer a peer-to-peer with Parkinson's Association. You just need to email us and we'll try to pair up anyone that would want to be a peer-to-peer or needs a peer-to-peer. So if anyone here is like, I would be completely okay with being matched with somebody just to talk about caregiver or an actual patient of Parkinson's, and we can kind of do a one-on-one to have that conversation, because that conversation needs to be had. That's the resources that we have so that we can help out with the emotional side of it a little bit more. Is that what you were asking, or did I just go off on a tangent?
Yes. Thank you so much.
You're welcome.
Yeah, there are a lot of great peer support opportunities that you can find in person in your area, or virtual options like Sydney mentioned. There's also Facebook groups that you can join. So if your husband's not willing or not ready to maybe speak up, a lot of times I'll coach people, maybe try a Facebook group, because you can be a fly on the wall. You don't have to participate. You can look at other people's posts. And a lot of times I'll coach people through, you can search on those groups. So maybe they needed to look for accessible housing or something they're experiencing. You can actually search for that topic in groups and see what was discussed. Just keep in mind, this can be anybody. You've got all walks of life. You might have some fun, interesting discussions that you might fall upon, but Facebook groups can be very helpful to know what's going on, just to kind of read through other people's experiences. And I really want to make sure that our caregivers and our spouses are getting taken care of. So make sure you find groups for you guys, because if you're exhausted, and tired and worn down, you can't be there for yourself or your loved one. So I applaud you for joining this group to see how you can help support yourself or your loved one, but also make sure that you're keeping yourself well taken care of and taking some self-care. Find your own support group, do something for yourself to make sure that you can be there for yourself and your partner, or your loved one.
Awesome. Is there anybody else that has any questions? These are some great questions.
Thank you. I would be interested if you get a group of, spouses or member families from the one that has it. I would be happy to be on there. And if you want me to lead, I can lead too.
Wonderful.
So I know because everybody is happening this, and it's very hard. It's very hard to not only manage, but also we learn day by day.
It is
in one day, it happens.
And it is a learn day by day, and each case is different for each person. So each caregiver could see one side versus one person sees the other. And it's great to have those conversations and be able to talk about it. So I'm actually going to put my email. Darci, would you like me to put yours as well, just in case?
Sure. Mm-hmm.
So I'll put my email and Darci's email in the chat. That way, if you guys want to be part of any of that peer-to-peer stuff or any resources that are pertaining towards Parkinson's Association, you can email me. If you have any questions for Darci, obviously, you can reach out for her. So let me put that in really quick. This one is mine, and I am copying and pasting hers in now. Again, thank you guys so much for coming to this. We enjoyed having you, and I personally really enjoyed this presentation, especially now it's getting warmer out. I think more people want to get moving and everything as well, and doing it the right way is always key. So with that, we'll go ahead and end our meeting. Thank you guys so much for coming out, and I hope you guys have a great one.
Bye.